Hey everybody, this is Dr. Ben Pearl with FitFoot U. So today I am here with Matt Gooch, who is a certified pet orthopedist. The rights for your title at Superfeet.
Official title is Vice President of Product and Innovation. So I get to span a couple of different big buckets of responsibilities. One of those is very traditional product stuff that you would think of, product design, development, product management. The other is all the biomechanical testing and validation that we do on our products.
So you were nice enough to agree to do a teaser for the Biomechanics Summit that we're doing February 7th, which is Super Bowl Saturday, so the Saturday before the Super Bowl. And we were talking about some of the challenges with athletes, with footwear, with the topic that you're going to be discussing, which specifically getting athletes, the marriage between the cleat, the orthotic shoes, and optimizing performance. Before I go on too long on that, why don't you give us a couple things that you feel would make this a relevant discussion for people to want to sit in on?
Yeah, I mean, besides, of course, the fact that it's the Saturday before the Super Bowl, so it's at the timing wise, there's a lot of reason that we might want to be talking about cleats and the
I'm
unique
hoping my
challenge.
Bills will be there, but that remains to be seen.
That's right. There's a lot of season left, but everybody knows any clinician, and for that matter, any athlete that has either worked with cleated footwear or has worn cleated footwear, yourself included, knows it can be really challenging to get a good fit, to have a piece of footwear like that that is going to perform the way that you need it to. And then you add in the further complication of how do you actually get a device that can help provide that increased function for the athlete inside of that footwear. And with everything from different sizing strategies for different sports, whether it's sizing down significantly that you might see in soccer, or just some of the unique challenges that very large, very strong athletes like American football players might present with the cleats that are available for them to utilize. It's really hard. There's a lot of factors, everything from just purely the geometry that the athletes can tolerate to the materials and the construction considerations of how do you actually optimize the way that that device is going to fit into a given cleat. And so in my presentation, we'll dive into some of those things. We'll look at not only kind of some of the examples of cleats that are on the market and some of the unique challenges of accommodating those, but also what the literature tells us around how you kind of can derive that efficacy that you're looking for from best practices from the literature, and then bring some general recommendations for considerations of how to optimize those for the athletes in kind of an everyday practice sort of scenario.
One of the things that you keyed in on was the importance of the feel for the athlete. And I like the fact that you were talking about a very well conditioned athlete. So, not only as an example, before we get to a seasoned, well conditioned athlete, but just let's just say a rec athlete, the feel as you're approaching the ball, as you want that intimate contact, that feel as you're kicking the ball, where you like to feel it on the ball of your foot. And then the other iterations that come from a professional, which are what, Matt?
Yeah, I think generally speaking, in my experience, kind of the higher level an athlete is, the more kinesthetically aware they tend to be. They're very in touch with their body and the way that everything, their gear, everything that they feel in regards to kind of what they're using and how they're using it. And as a result of that, it really creates an amplification a lot of times of any device that we put underneath the foot. And so oftentimes what ends up happening with a lot of these athletes is they don't necessarily even get introduced to something like either a custom device or an over-the-counter insole until there's a problem. And so now they're already in a state in which they are kind of in a rehab mode. They're trying to adjust, they're trying to recover from an injury. And then you introduce a device which also has an acclimation period associated with it. And it can create a lot of challenge for the training staff, the sports medicine staff that's working with them, and just the athlete themselves as they go through that recovery cycle. And so one of the things that we'll talk about is the benefit of the longitudinal introduction and wear of a device earlier, not just as the result of an acute issue, but the value that it can provide as just part of the process of helping cleated footwear fit, function, and perform better for that athlete, and not just having it be the immediate reaction to that acute stress that an injury often provides.
And you bring up an interesting sidebar to that same kinesthetic awareness with the patients that we see that have pathology and may have kinesthetic awareness that is off kilter. And so you'll dispense a device that what looks to be a corrective position, but it actually is something that is not tolerated by that patient, or at least in the immediacy. And
Absolutely.
so two things, right? Setting the expectation, but then what do you think about your estimations of trying to predict that ramp up to how much they can tolerate? What are some of the things that you would say to a practitioner?
It's a great question. And I think probably in a lot of different scenarios, if there was a simple and easy answer to that, it would be one that everybody is using. But I think there's two things particularly that we'll talk about a little bit in the presentation as well, but I just use in general as a general guide, not just relative to cleated footwear or high performing athletes, but anytime that I'm working with somebody on trying to figure out what that dose and dosage response, that combination of materials, shell stiffness, geometry profile, all of those things that are considered as part of just trying to dial in a prescription or select an over-the-counter device. And that's plantar sensitivity. Oftentimes, we only really think about plantar sensitivity relative to deficits of things like peripheral neuropathy and the complications there. I think there's an immense amount of value in utilizing that information more broadly, as it really gives us an indication of the magnification that the geometry and stiffness of the device are going to present underneath the foot, regardless of the footwear that it's going into, knowing that in the cleated scenario, it's going to amplify that as well, simply because of the intimacy the device is going to have to the foot. I think the other is some really simple tools and evaluations like supination resistance. I think it gives us a really good indication of the mechanical stimulus that the insole or the custom device can provide to augment the kind of inherent larger mechanical response that the body goes through to having shape and geometry underneath the foot. And so I think those two things are something that most clinicians certainly have the ability and access to be able to perform as part of a regular evaluation from a biomechanical standpoint. They don't add a lot of time, but I would say they give you a lot of great insight into tuning the way that you might provide a custom device or an over-the-counter product as well.
Now, Matt, you shared with me that you had, and this will be our 2-minute warning for the end of the teaser segment. You shared with me you had a high inversion ankle sprain at some point in your athletic pursuits. Tell me what that has looked like for you with your rec sports in terms of your own preferences.
Yeah, I mean, everybody loves learning about things that have happened to themselves at some point in their life, right? So as clinicians or people that are interested in this biomechanical space, I've been very fortunate or unfortunate, I guess, depending on your perspective, to have accumulated an awful lot of injuries. I was fortunate enough to have the opportunity to be a Division I college athlete, and usually people ask me like, "Hey, what events did you run and track?" And I usually respond by saying, what I ran most effectively was to the training room. I did a lot of stupid things to injure myself. And I feel like that experience has been very informative. You mentioned having, in essence, I had a complete syndesmotic rupture. I avulsed my deltoid. I broke my fibula. I had a lot of kind of damage to my ankle. And this was post my kind of major athletic career, much more into the recreational side of things. And it's been really challenging at times. It was quite a while ago at this point, but I still get random flare-ups where it's a little bit unknown whether it's bursal inflammation, whether it is a larger just response systematically to the hardware. I have two tight ropes that are in my ankle as well. So something happens and I will kind of wake up without necessarily what seems like an easy to identify predisposing event. And I'll have a really swollen ankle that is very uncomfortable. And so I have a process now that I work through when that happens. I utilize some really interesting things like carbon fiber plates and other things to really create kind of immediate medial lateral stability for my center of pressure in that scenario, and combined with then some additional shape and geometry from a device. But I think everybody kind of develops these strategies to get through what they have in front of them, whether it's an immediate, whether it's recurring. Certainly, the athletes that deal with kind of that weekend warrior type of pain and discomfort on a rolling basis, especially as you age and your tissues aren't as resilient as they used to be, and all of those things. And so I think both from the athlete perspective as well as the clinical perspective, I think we'll talk a little bit about how some of those larger principles can be applied, certainly to the cleated scenario, and maybe some considerations that both clinicians, whether it's for themselves or for the athletes that they're treating, can think about when it comes to just the complication and nature of dealing with a really challenging footwear environment in cleats.
Well, thank you so much, Matt, for doing this. We look forward to your participation February 7th, helping clinicians like me. I look forward to not only you, but continued collaboration with the Pedorthist Footwear Association to help us along the metaphorical goal line and get across that. Certainly a lot of challenges with athletes that want solutions now. So there's an immediacy to it. But I look forward to hearing this and more February 7th on the Virtual Biomechanics Summit. You can find that information on the American Academy of Podiatric Sports Medicine website, and soon to be on your association's website as well.
Yeah, I appreciate it. I'm really excited. I think it's going to be a great event. There's certainly a really great faculty that you've assembled for this event. So thank you both to you and the Academy as well. Like I said, I think it's going to be a great event, and we're going to get some good education just in time to then celebrate the Super Bowl the next day. So it's going to be a lot of fun.
Hopefully these guys, they deserve one if you're a Buffalonian. Thank you, Matt.
Yeah, for sure.